Hi, welcome everybody. My name is Bengt Andersson and I work as a senior advisor at the Nordic Welfare Centre in the area of digital transformation in public sector. Today we will have a webinar here about loneliness and social isolation among older adults during the COVID-19 pandemic. My colleague Ayla Mehta is responsible for our Nordic initiatives at the Nordic Welfare Centre concerning combating loneliness and social isolation. And Ayla has during the last years been coordinating a Nordic expert group on loneliness and social isolation. And you will meet most of the members here today in our two panels that we have. As we all know, involuntary loneliness can affect all groups, including older adults. Involuntary loneliness is just as harmful as to health as smoking. The risk of stroke, dementia, and mental illness increases. For that reason, efforts to combat loneliness and social isolation is a key public health priority. And then this is when everything is normal. What happens when a pandemic comes with quite tough restrictions concerning social activities? We are somewhere in the middle of a pandemic and post-pandemic situation. Maybe we thought that we were in a post-pandemic situation, but red numbers from countries around Europe gives us indications that we really not there yet. But there is a lot of going on concerning facts about what side effects the pandemic has had on our citizens during this webinar. And here today, we will focus on loneliness and social isolation among older adults during the COVID-19 pandemic. Has loneliness and social isolation among older adults increased in the Nordic countries because of the social distancing during COVID-19? What do we know about mental and physical well-being of older adults under this period? And could it be that older adults are more resilient to changes during crisis, maybe? What does the latest Nordic research in the field show? Well, maybe we can't answer all these questions here today, but we will take a look into it. And today's program, we will start up. We have two sections. The first sections we will look into research, and on the second section we will also look into interventions and research. So we will have two presentations, and after each presentation we will have a panel discussion. So again, welcome to all you. Were over 100 participants that signed up from all Nordic countries, researchers, but also from regions and municipalities and authorities. And from all Nordic countries, as I said, but also from Estonia, Latvia, and Lithuania. A warm welcome to you here today as well. And now we will start up with a 15 minutes presentation by Thomas Hansen, that is a research professor at Oslo Metropolitan University in Norway. After that, we will hear reflections from our first panel, and I will get back to you who they are and have that panel discussion. So welcome, Thomas. You will foremost present a longitudinal study of the Norwegian older adults' physical well-being before and during early later stages of COVID-19, but also give a couple of snapshots from other Nordic countries. So welcome, Thomas. I give the word to you.
Thank you, Bengt. I will try to answer some of the questions that Bengt posed regarding change in well-being and loneliness during the pandemic among older adults. Here we have data from Norway, and these let me see if I can start. This data has now been published. Actually, it just published in the European Journal of Aging. I work at the Norwegian Institute of Public Health in Oslo, as well as Nova and Oslo Met University. There's been a lot of focus on older adults during the pandemic, and how have they been faring, and what has the increased isolation done to them, and especially some subgroups of older adults have been particularly in focus in terms of consequences. For example, older people with who are socially isolated and with health problems. So how did they cope with COVID-19, and which subgroups were the most vulnerable, and were there signs of emotional fatigue as the pandemic dragged on? So the different stressors of this pandemic can be headed under the health threat of the COVID-19. So it was quite uncontrollable and seemed to have no end date, and present threats to both to individuals as well as their loved ones. But also, of course, there was the social distancing measures that brought about increased social isolation, restriction of pleasurable activities, and a lack of access to care facilities and much needed relief services and home services. But like Bengt said, older adults could be particularly resilient. There is a lot of evidence showing that humans do show a lot of resilience and adaptation to crisis, and that people tend to sort of return to their baseline level of well-being after quite short time after these events. Also, of course, that has to do with the influence of genes and dispositional factors. But also older adults might be uniquely able to cope. There's a lot of research showing that older adults show less stress reactivity, greater emotional regulation, but also the greater use of accommodative coping strategies. So they tend to compare themselves to others who are worse off and sort of find they're able to maintain a level of well-being in adverse circumstances. Also, of course, they might draw on past experiences. So older adults have gone through previous challenging times, so that might be helpful. But also there might be positive experience. So in past mass tragedies, we have seen, for example, 9/11 and others, we've seen an enhanced sense of social cohesion and an enhanced sense of meaning. People go through a challenge together and experience some shared experience, and also they tend to support each other and find an increased sense of social support. And perhaps more among younger adults, but perhaps also among older adults, there's the joy of missing out. There's a time out from all these different opportunities and time pressures. There has been some prior Nordic loneliness, but not much from prior findings on changes in well-being in the Nordic countries. But I was actually surprised how little evidence there is. So Kiwi and all and Hansen and all has presented data that show that the level of well-being and loneliness was quite stable in the beginning, but increased in later data periods. And the latter study had shown also among the 70-year-olds in the Stockholm region. We see here their data showing that there was a quite stable level of loneliness before the pandemic across different years, but a quite strong increase in the level of people reporting loneliness in 2020, in June 2020, so in the quite early period of the pandemic. And there's also some evidence from Denmark that's presented in a report, show high levels in March, but then it's sort of like a U-curve, so high in March, lower in June, October, but then an increase in November, December last year. But there's a lot of knowledge gaps. So there's been a limited focus on risk and protective factors. Are we all in the same boat during this experience? Few Nordic studies, especially that use panel data. So we saw, for example, from the Swedish data that they use time series cross-sectional data, but very few studies have used panel data. And there's a lack of evidence from later stages of the pandemic. Most of the evidence so far, especially in the international literature, is from the first 3 to 6 months of the pandemic. So we ask, how did they cope? Older adults, how did they cope in terms of psychological and social well-being? Which subgroups were impacted the most by social demographic factors, their level of social resources, and then prior physical and mental health situation? And did the impacts vary by the stage of the pandemic? So we have data from June in the summer of 2020, 3 months into the pandemic, when these restrictions were quite relaxed. And then we have data from November and December, where infections were rising and restrictions. We use data from the Fylkeshelseundersøkelsen, there's a county health survey in Norway, from 2 counties. It has to be said that these counties were the 2 least infected counties in Norway during the pandemic. So in a way that's a shame, but at the same time that sort of shows sort of the best case scenario. So any negative impacts in these counties are likely to be, these impacts are likely to be even higher in the other counties. So we have data from before the pandemic. There's a quite large sample, 8,000 people, and from June, and then November and December 2020. Actually, we're about to re-interview them now in November, December 2021. So that's quite exciting. And we have already published 2 papers using 2 or 3 waves. There's a lot of measures of well-being in this survey. So we have these questions: life satisfaction and positive emotions during the last week, and negative emotions, including a loneliness measure. So we have merged these into psychological well-being, the first 3 questions, and then the last 3, the anxious, worried, and down and sad, are merged into psychological ill-being. And then we have a single measure on loneliness. We also have the UCLA 3, but it's measured only at time 1 and time 3. Independent variables, I think in the interest of time, I'm going to be quite quick with these. But you can see the slides after. I'm sure Iceland and the others will make them available. And as well as the analytical strategy, I just want to highlight that in addition to doing the analysis of means, we also use the analysis of low scores, that score at the low end of these 0 to 10 scales, to show a little bit more about how the more serious level of adversity is changing. Okay, so from time 1 to time 3, in terms of loneliness, and this is a curve for men, we see that levels were quite stable from before the pandemic to in June, and then increased quite a lot in November, December. And this is a pattern for women, and we see that the pattern is quite much stronger for these older women compared to the older men. So loneliness rates were quite dramatically increasing in November, December. To show that a bit more, when we look at these high scores of loneliness from score 6 and up, they increased from 8% to 18% for women, and from 7 to 13. So a quite dramatic change in loneliness, I would say. In terms of ill-being, that had to do with being anxious and afraid and depressed, we see a very similar pattern. So a negative change, not so much in June, but in definitely in November, December, and more so for women than men. And the change in the high scores on these items were more dramatic for women. So, for example, the level of be feeling worried, that was 90% before the pandemic, changed into almost 1/3 of women in November and December. When it turned to well-being, we've had to do with life satisfaction and feeling pleasure and joy. There's a similar pattern, so much stronger change for women. And when we look at these low scores, so feeling unhappy, that changed from 4% to 10%, for example. So quite dramatic shifts. I always like to try to say something about substantive changes. And so the level of well-being changed. For example, the level of life satisfaction changed by a full point from before to in November, December of the pandemic. So what does that actually mean? Is that a big change or a small change? Well, when we compare to prior studies that have shown a change in well-being every year before and after these dramatic life events. So for example, widowhood, unemployment, severe disability, these events are associated with a 1 full point drop in life satisfaction on that 0 to 10 scale. So it's a similar drop as we see from before the pandemic to November, December. So that sort of indicates that there's a quite dramatic shift. And like I said, this was in the least affected counties in Norway. So what about inequality? When we look at risk and protective practice, who were the most heavily impacted? When we look at age, a little bit surprising, we didn't find much difference, similar with education, unemployment, and urbanicity. But when it comes to being single, no, it was a bit surprising that that didn't matter either. Being single didn't have an effect either. But when it comes to social support, that showed to have an effect, but in a opposite way in terms of what we expected. So, for example, in terms of ill-being, when we look at the change in ill-being, feeling depressed and worried among groups with different level of social support before the pandemic, we see a different pattern. So the gray curve, well, first we see a lot of variation in a predictable way before the pandemic. So people with high level of social support, they are much less worried. But this variation decreases a lot in November, December. So COVID is sort of a leveler in a way, which has to do with people with high level of social support before the pandemic experience an increase in feeling depressed and worried, whereas people with low social support, they seem to fare much better. They seem to experience less depression and worries, etc., in the pandemic than they did before. So it's a bit of a puzzle. It could, of course, have to do with regression to the mean and these methodological things, but I think it also has a lot to do with how COVID presented a more different and larger contrast in life situation for those with high social support. And also perhaps people with low social support was a bit experienced in some of these challenges, perhaps. So a similar pattern when it comes to loneliness and also well-being, that sort of it seems to suggest that people with problems before the pandemic seem to fare a bit better during the pandemic, whereas the majority with less problems before the pandemic, they seem to do a bit worse. And chronic health problem did not matter, but subjective health has mattered a little bit. And in the same way as we saw with social support, that the pandemic is sort of a leveler in a way. Also with psychological distress, so people with a lot of psychological distress before the pandemic, in the blue curve, they seem to do better during the pandemic. The level of distress went down during the pandemic. Like I said, that could have to do with them having more experience with the emotional regulation, for example, fear regulation, regulation of worries, etc. And also perhaps that those who struggled before the pandemic sort of benefit a lot from this increased sense of social support, perhaps during the pandemic, and the sense that we're all sort of going through a shared challenge together. And it could also mean that it's a bit more openness in society regarding their problems, and also that they sort of finally everyone else is sort of feeling what I've been feeling for all these years. So that could be helpful to them also. That's sort of finally people share the experience of isolation and loneliness. Okay, so in summary, well-being was quite stable in June, but decreasing in November and December. Of course, well, that could have to do with COVID fatigue, that the situation is now dragging on. It could be, of course, the stronger restrictions in November, December. And it could also have to do with seasonal fluctuations, but prior evidence actually doesn't show much seasonal fluctuations, not even in the Nordic countries. So some studies show some fluctuations, but I don't think these are large enough to explain the quite strong fluctuations we find here. So I would conclude that either one or two is perhaps the main culprit here for these patterns. Stronger impacts for women, like I showed, but no other sort of risk groups in a way, which was a bit surprising, that perhaps these impacts didn't vary so much by health status or social demographic factors. When it comes to age, I must add that there's a stronger selection, of course, in the oldest age group, so that might explain that finding. This is a web-based survey after all, and we know that only the more resourceful and of course home-dwelling older adults, etc., take part in these surveys. So we have to bear that in mind. COVID-19 as a leveler, as I explained, these improvements, we saw improvements in well-being actually amongst those with low social psychosocial well-being before the pandemic, which was a bit surprising. But once we started to think about it, it sort of made more sense, I think. I wanted to say thank you, and feel free to email me at my address if you have any questions or anything, and you can also look up these data in these two papers. Thank you.
Great. Thank you. Thank you a lot, Thomas. You will be hanging on here, so if you have any questions, put them in the chat, and we see we can bring them up during the panel discussion we will have right after this. And you also see that you who look in the chat that Jenny has put in some links so you can get more information about what Thomas here has presented. So thanks again, Thomas. Now we will go on and for our first panel. And in that panel, we will have Lena Dahlberg. That is, she's an associate professor of social work at Dalarna University in Sweden. We have Halldór Guðmundsson, associate professor of social work, University of Iceland. Tian Gandu, associate professor at the Finnish Institute for Health and Welfare, Finland. And then we also have from WHO, World Health Organization, Christopher Mechton, technical author of demographic change and healthy aging. And we will go around with you to you all, and I have a couple of questions to you. So I start with you, Lena. What's your reflections on Thomas' presentation, and do you recognize the results from Norway from your perspective? Could the situation be similar in Sweden?
Thanks for inviting me to this panel, and thanks, Thomas, for a great presentation. It's really interesting to take part of. I think there's been quite a lot of research during the pandemic, and quite a lot of research that unfortunately is not that good. There's a lot that has been done on convenience samples. It's really difficult to know how representative it is. I mean, do they really include the most frail and the most marginalized people? Probably not. There's also been a lot of studies done online, which can also exclude people. There are exceptions where people have done, researchers have done research online and managed to include with high response rates and include people where they're given support for people to complete the questionnaires. But there are also a few high quality studies, and I think Thomas has now presented a really well established study, which also means that when you build on a study that already exists, you get something to compare with. It's not just an ad hoc where you don't know what the level is. So I think that's really great. Do I recognize it from Sweden? There's a few good studies in Sweden that have been done during the pandemic. Thomas referred to a couple of them. One in the Stockholm region, where they found an increase in loneliness, particularly among women and people who lived alone. It was actually living alone that was driving the association with being a woman, because more women live alone. There's also been a study in Gothenburg that Thomas mentioned that found an increase later in the pandemic or in the data collection period. And then there are a couple of studies. There's one in Stockholm, SNAC, which is again a well-established study, but they didn't have the item of loneliness in the previous round. So again, you can't really compare the situation with what it was like for this particular measure. And we are now collecting data for a national study, SWEOLD, where we have followed loneliness from 1992 onwards. And from 1992 to 2014, it's been very stable. So we're very curious to find out what this data collection will show now. There's also been European studies showing an increase, and particularly among women and people living alone and the oldest age group. So I think what I'm most surprised at it, perhaps in Thomas' study, is that they don't find an association with living alone. That I think is a little bit surprising. So I think a last reflection maybe is that I think we need to really be cautious about transferring the result. How generalizable are they to different countries? Because we have had very different restrictions to control the pandemic. So I think it would be very interesting, if you want to learn for the future, to compare different countries, how we, what restrictions have been put in place and when, and what effects that have had on other things like such as loneliness.
Yeah, that would be very interesting. Maybe we're a little bit early there, but then we could do that, and there will be more to come, of course. Thank you, Lena. We go over to Iceland. Halldór, what's your reflections, and do you recognize what Thomas presented here from an Icelandic point of view?
Yeah, thank you, and thank you, Thomas. Excellent presentation. Interesting to see. Yes, in a bit of a way we do that because we had a research done in the middle of the pandemic in November, December 2020. But we only have one question that was related to loneliness among older adults in Iceland, and compared to previous research regarding that particular question, we have a similar situation in Iceland. We seem to have a rather stable situation, a little decrease actually in experienced loneliness, but in general we don't have a huge effect that we have in that research. But nevertheless, I was just looking at the data recently, and I see that since 1999 we have a decrease of people that is not experiencing loneliness. So in a way, we could say we have some notions of changing. But I agree with Lena that my thoughts did go a little bit to the people that is not participating in the research, especially those people that are living in, for example, nursing homes. And I have mentioned that earlier in discussion in this group, that there are interesting results from Finland about the effects of loneliness among residents of nursing homes. And I think it would be interesting for us to do a little bit more research or try to find out more about that in the future. So, but thank you, Thomas.
Thank you, Halldór. Thank you very much. And then we go over to you, Tia, and from Finland. What are your reflections on Thomas' presentation, and do you recognize this from your point of view in Finland?
Thank you. Many thanks for Thomas for excellent presentation. I think it's really interesting and really very, very important. And I think many things I do recognize also from the Finnish perspective. So when we think about Finnish situation, I mean, at the first couple of months of the pandemic or first half year, we had very, very strong recommendations for all older adults to stay at home in sort of quarantine-like conditions. And also, for example, visits to all nursing homes were virtually cut. So that was quite hard on older adults, the first phase. And we have some data showing that the persons do. There's a large proportion of older adults who report that they experience more loneliness than before. Depending a little bit if it's a home dwelling sample, it can be from 20 to 40% from different studies who report that they feel loneliness. And then in the nursing homes, it's much more, whether it's asked from the residents or if it's evaluated by the care staff. So it's very, very large impact. They express strong concerns for the loneliness and for the lack of social contacts in the nursing homes. We also see that many of the negative findings seem to be more pronounced among women, as you also showed. So it seems to be the same phenomenon. We also saw something that's maybe a little bit in line with what you presented as COVID as a leveler. So we have seen, for example, that those people who are doing a little bit better off, who are maybe more educated or more healthy, those are the people who report that their social contacts have decreased more. So maybe, of course, they were probably on a higher level to begin with, but they seem to be reporting more of these. While the loneliness and other things, they are maybe more reported by persons living alone or having more disabilities. So it depends a little bit on the question that is asked and what seems to be the populations more affected.
Very, very interesting. Thank you, Tia. I'll go over to you, Christopher. Mikton, you work at demographic change and healthy aging at the World Health Organization. And I thought, what is your experience about loneliness and social isolation among older adults under the current pandemic from a European and global perspective? And what you hear now here, do you hear any differences and maybe similarities with the Nordic research findings?
Yeah, I'll tell you a little bit about, well, thank you for inviting me here and nice to speak to you all. I'll tell you a little bit about a systematic review and meta-analysis we're doing on loneliness before and during the pandemic. But first of all, I'd like to congratulate Thomas on really an excellent study. And, you know, such kind of methodologically rigorous, fine-grade studies are all too rare in the world. I know in certain parts of the world are more frequent, but in so many countries, we have such poor quality studies that it really do not allow us to do much with them, let alone kind of formulate policy. Yeah, I was intrigued by some of your results, the women experiencing more loneliness. Are men doing anything in particular? Does it have anything to do with women being widowed more often, or maybe not? Yeah, some of your results seem to actually contradict that. I'm not sure, just an intriguing finding. As well as the social support, the kind of, you know, counterintuitive result in relation to social support. And something you found that confirms or converges with what we found in our meta-analysis is that age was not a factor, which I think to us came as a surprise. I'll tell you a little bit about the meta-analysis and you'll see some similarities and differences. So this is a meta-analysis and systematic review led by someone called Mareike Ernst in Germany. And we looked at 32 prospective studies. We didn't include yours, probably because it wasn't available at the time we were doing the searches. I'm not sure, but probably. Total sample of 184,000. We did a meta-regression as well. I mean, the kind of headline finding is that this was all ages, these 32 prospective studies across all ages. We found that there was a slight increase in loneliness during the pandemic. Standardized mean difference of 0.3. So that's, you know, small, I think that's generally considered, but definitely there. The meta-regression found that sex was not associated with the increase. Neither was age, just like you found, and I think that came as a surprise to us. Neither was time between pre-pandemic and pandemic assessment. We thought maybe, you know, the longer the time, the more the loneliness. No. Or the number of months since the beginning of the pandemic. None of these were associated. So some findings that converge with yours. We didn't look at social support, and we didn't look at the duration or the degree of restrictions. But there is another study, I don't know if you're aware of it, another meta-analysis by Booker and Horstmann, I think they're called, in Germany. And they found that the duration of restriction was associated with the increase, which makes intuitive sense. The only variables we found in our meta-regression to be associated with the increase in loneliness was whether it was a clinical or non-clinical sample, which kind of contradicts what you found, and research design. The higher the risk of bias score, the higher the increase in loneliness. So yeah, so these were our findings, which converge with many of yours. And I think the fact that older people have not suffered more from loneliness is an intriguing finding. And I think it's something that really would be worth investigating a little bit more to try to find out why. Is it, as you said, they have more resources, they're more used to maybe these kind of situations, so they're able to cope with them better? I'm not sure. Thank you.
Thank you. Yeah, interesting, because maybe this is not what we get from the media or so on. The picture maybe is a little bit different from what we hear from you here. Christopher, is it this? Could you send us links to what's been done from your perspective, and then we could send it to all the participants maybe?
It's not been published yet.
Okay.
It's on the verge of being accepted. We're doing the final revisions, and we published early next year. So I can't. But yeah,
but
sorry.
as quick as it is, we will deliver that to all your participants.
Okay, yeah, thank you.
Yeah.
But the other systematic review by Booker and Horstman, you can find. I can send you a link.
Perfect. Thank you.
That's published.
Yeah. Yes, thank you all. I'll see here. And I have a couple of questions to you, Thomas, from the chat. How was urbanicity defined and measured? Is one question.
Yeah, we have information about their municipality where they live in Norway, and as Statistics Norway have this system for categorizing these different municipalities in terms of how many residents there are living there, how dense it is, and their access to different facilities. So it's an index that has been used for many years that I'm not too familiar with, but it is described in the paper. But it has to do with it's not self-reported. It's has to do with density and population, how rural or urban municipality is considered to be.
Yeah, and the follow-up question is: can you see any difference regarding how and where they live? Are there sort of any differences, urban contra rural or sparsely populated areas?
No, we didn't find any difference. But both of these counties must be said to be quite rural, and there's no difference between the two of them, even though one is in the southern end and one is in the northern end of Norway. But they are both quite rural, and but we have cross-sectional data from Oslo during November and December, and that seems to paint a much more negative picture, even more negative picture. So levels of loneliness, for example, among older adults is higher in Oslo than in these rural areas in November, December. Mm-hmm. So that sort of attests to the influence of these different restrictions and infection rates, etc., because Oslo was much more heavily affected than these rural areas.
Mm-hmm. Halldór.
Yes, I just want to support this, what Thomas was saying, because in the Icelandic research since last year, we see differences, statistically significant differences between the cities in the Reykjavik area and in the rural areas.
Lena.
Yeah, I just wanted to comment on what Christopher said about gender. We did a systematic review of longitudinal studies, and it was studies looking at risk factors for loneliness, and it's at bivariate level. So if you only look at one, how one variable is associated with loneliness, it's quite consistently that women are at higher risk of loneliness than men. But in most multivariate analysis, this is not there any longer. So it is explained by things that comes with being a woman. So particularly living alone, being widowed, but also health problems and functional disabilities. And the same goes with age, really. So there's a strong bivariate association between higher age and loneliness. But when you control for health and living alone, things that comes with age, that association is not significant.
Yeah. I'm aware. I think of that systematic review, and it's an interesting area because there are many counterintuitive findings that are kind of in need of explanation and may point to possible solutions.
Thomas.
No, I think whenever there's a surprising finding and a paradoxical finding, I think it's worth paying attention to the relative nature of these constructs. So loneliness is perhaps the prime example of one of these well-being measures that's very relative in nature. So how you perceive that others are doing and what you used to and what your social needs are, that's very important to explain your level of well-being and change in loneliness and well-being, for example. So, for example, why did women fare a bit worse during the pandemic? Could be because of their social aspirations and what sort of social contact they used to, and the contrast in change in life circumstances, but also why these single adults seem to fare quite well during the pandemic. It could be because they have they're accustomed to more isolated situation, and these coupled older adults might have sort of higher relationship needs and experiences and standards. So their sort of loneliness threshold is a bit lower. So the change in events might lead to a larger contrast for them, leading to more loneliness among these coupled older adults. But it has to be said also that these older adults living alone, they had more loneliness before the pandemic, but they have also more loneliness in the pandemic. It's just these changes that are a little bit paradoxical, but they are still faring worse than these coupled older adults.
One question I'm thinking of is about the future. How can these findings learn us to prepare for the next pandemic? Who wants to answer that? What do you think? What can we learn from this?
I can make a start. I think one of the key issues is that it's a very difficult balancing act, you know, the risk of the spread of the virus versus the negative effect of the restrictions. And how do you balance that? In Sweden, we haven't had a full lockdown like many other countries have, which is due to the constitution. It has not been possible, but we have had a lockdown or visit bans on nursing homes or care homes for older adults. And that's been a big debate. I mean, some people argue we should have done it much earlier, and some people say, well, how can we do it at all? Because they actually have contracts on their apartments and flats. And I think there's also an argument about if you live in a care home, you are in the last years of life in Sweden, because we don't have that many places in care homes these days. So you don't have that long time left, not many years anyway. And is it worth risking not seeing your parent, your family for a year compared to potentially getting a deadly virus? What is the balance there? And who is to say, is it the older person who should decide if he or her are willing to take that risk, or is it staff? But I think the other thing that's been really highlighted in Sweden is the role of formal care. I mean, still a minority of older people who get formal care. Most people cope without or have informal care. But for those who do, that are, of course, the most frail individuals. And formal care then have a really key role to be their social contact if you have severe restrictions on isolating yourselves. And I think we need to create more room for staff to actually interact, have a social function as well, not just see to the physical needs. And I think that is extremely important, particularly in pandemics, but also under normal circumstances.
All times, of course, and particularly during a pandemic, especially. Okay, Thomas, you started up this, and I think you will get the last word as well from this panel, because then we have to move on. So, Thomas.
Yeah, well, the balancing act, Lena took my point there. But the other thing I was about to say that, like we discussed already, these individuals who are in the most dire situations in normal times, very lonely, isolated, etc., and depressed also, they seem to fare all right during the pandemic. And we see also that levels of suicide rates has gone down actually in Norway. But I think what's really important now is to see what happens after the reopening, whether they sort of go back to their dark situation, and whether we see an increase, perhaps their level of well-being and depression would be even worse than before, seeing that everyone else is now going back to their old and celebrate and sort of moving back to the old life, but they themselves are going back to their more dire situation. So that might lead to an increase in suicide rates and depression rates and levels of loneliness also. So I think that's an interesting topic, or an important topic to keep an eye on.
Okay, there's lots of things we will have a look an eye on when it comes to this, which will coming up. And thank you, Thomas. Thank you, Tia. Thank you, Halldór, and thank you, Lena, and also Christopher, of course. But to all you for this part of the panel, Christopher, you will come back in the next session. But to the rest of you, big thank for this panel. And now we move on to the second part of this webinar. We will focus on intervention. We will have the same setup and start with the presentation, followed up by the panel discussion. And then, hi, Anu, welcome. Anu Jansson is Director of Development of Participation at the Finnish Association for the Welfare of Older People in Finland. And you will present an example from Finland when it comes to loneliness and interventions during and after the COVID-19. So, Anna, welcome again, and I give the word to you.
Okay, I'll try to raise some reflection to alleviation of loneliness here and some reflection from Finland. Could you please put the next one? Thank you. And this presentation is at the heart of several studies. They all point how we should pay attention to alleviation of loneliness, especially now after COVID-19. Next, please. Next, please. And when we think about alleviation of loneliness, it is very important to address diagnosed experiences when planning those interventions. For example, not all of them who are living alone are lonely. And on the other hand, those who enjoy being alone from time to time and have experiences of solitude may also suffer from loneliness. And these issues, like we see here, are dependent on place, time, social relations, and context. And COVID-19 is a major context and time period also in our lives and loneliness. Next, please. And then dimensions of loneliness are very important also. Typically, loneliness is divided into three dimensions: social, emotional, and existential loneliness. And next, please. And next, please. Thank you. So, for example, when alleviating loneliness, it is not beneficial to add groups and activities around a person if a person experiences existential loneliness. So it's very important to see what kind of loneliness a person is suffering from and think about these interventions to that situation. Next, please. And then we have some major elements to alleviation of loneliness. There are reducing the gap between what we desire and achieve from our relationships, and then reflecting what is realistic in our lives. And then also we want to promote coping skills to loneliness. Next, please. And when these social relationships are reduced, a human being lacks like a mirror against which to reflect one's experiences and views. And this mirror can be found in another person. It can also be found in art, culture, or nature, for example. Next, please. And then I will tell something about what we have done in the Finnish Association for the Welfare of Older People during and also after COVID-19 to alleviate loneliness. We have the well-described group model Circle of Friends, which was created about 20 years ago in Finland to alleviate loneliness. And it has been tested in the randomized control trial. And also we have tested about its feasibility in the long-term care facilities. And right then when COVID-19 pandemic started, we started also to modify the original Circle of Friends model into online groups. Before that, we have had face-to-face groups like many other organizations also. Next one, please. And then after beginning, we did some pilot study. We interviewed in a qualitative study those participants who participated in these online groups to find out about their experiences about loneliness alleviation and the feasibility of this modified model. We should modify this face-to-face model to online model, but we kept this original structure of Circle of Friends. And many of these participants said that this is like having a coffee break at the same table, even if we are separated from each other. And they said that this was a very important group to loneliness, but also to COVID-19 reflection. Next one. And then we have also Circle of Couples for people with memory disorders and their spouses. This is based on Circle of Friends group model. And these participants said that when I found I had a dementia, I felt like I was all alone. It was such a lonely feeling. And this situation is also was also before COVID-19 and after COVID-19, but it was felt quite tremendous during COVID-19. Next one, please. And these we also interviewed, Laura Rautiainen interviewed the Circle of Couples groups, and participating in the Circle of Couples opened their eyes. They were not alone anymore. They felt they were not alone anymore, and they had peers who understand their situation. It was very important. Next one, please. And then in Finland, during COVID-19, at least here, we were told to enjoy nature. But however, of older people using social and healthcare services, many of them had spent their daily life only indoors throughout this period, and half of them spent less time outdoors and in green spaces than they expected. Next one, please. And now we have this Resetas project where we suggest that social prescribing using nature-based elements would be an antidote or element to alleviate loneliness after COVID-19. Nature is very important to us, and the nature-based empowerment is important for us at any age. So it may also be one major solution to loneliness after COVID-19. And what is Resetas project? Resetas is an EU-funded project that will test and evaluate nature-based social prescribing in many countries. And Resetas in Finland explores nature-based social prescribing in a randomized control trial, and this study is done in long-term care facilities. Next one, please. And these nature-based solutions may be many things, but in Resetas, the interests of lonely older people will be real and visible in these interventions. They can be gardening, nature in art, many things. But it is quite nice if you visit Resetas website so you can find more information. Next one, please. So in the end, it is very vital to listen to older people's experiences of loneliness in a human way and to work on those experiences, real experiences, so that lonely older people may experience the rest of their lives as meaningful as possible without loneliness. And these loneliness interventions are very important. Thank you all.
Thank you, Anu. Very good. Thank you for a very good presentation and a lot of hope in the intervention that really can make a difference both before the pandemic and then also in the pandemic. So, and I tell you all participants, if you have questions to Anu, put them in the chat and we'll bring them up after we will go on now with our second panel. So we have opportunities to put them in the chat, and I will get them from Jenny and tell them to Anu. And you will hang on, Anu, in this also in this second panel. And now I would like to present the ones that will participate, where we'll discuss this area of interventions. And it is Kristine Svane, that is director of Ensamma Gamles Värn in Denmark. It's Karin Lennartsson, sociologist and researcher, Aging Research Center at Karolinska Institutet in Sweden. It's Maja Artsen, a research professor at Oslo Met in Norway. It's Fredrika Nyqvist, academy lecturer in social policy at Åbo Academy University in Finland. And welcome again, Christopher Michtan. You'll be back in this session as well. And we do it like we did before, the same kind of procedure. And I would like to start with you, Kristine. What's your reflection on Anna's presentation? And do you know any successful interventions during this period in Denmark? Kristine?
Thank you very much. And thank you, Anu. We should all be running out into nature now and not sitting here behind our screens. Well, actually, there's been half a billion Danish kroner put into experiences that also have to do with experiencing culture, like you mentioned, and art and so on, in order to engage people in activities that are not merely social, while they also tend to be social, but to try to raise the awareness that you can get comfort and also be stimulated in other realms. So that has been this money has been set off from the government, but it hasn't been evaluated yet. So the only evaluation of projects that we have, actually, there's been a seminar while we speak that documents activities that are before the pandemic. But I want to point to a new report that has just come out in Danish, but the authors are working on English language articles, which is about interventions to reduce loneliness. It's a systematic literature review of 136 effect studies. And why it's important here is that it points to the fact that all efforts, also social gatherings, do have a positive effect on loneliness. So there is some kind of reduction, but the projects that have more importance or more effect on loneliness are those that also work on a psychological dimension. So not just the social gathering. Like you also mentioned, Anu, it's very important to look at people's situation. What kind of loneliness do they experience that we can't tell from the outside that a person is isolated, whether that person is actually lonely. But here it has to do with also working on the psychological dimension of loneliness, or that the difficult situation that persons are in. So that's an important finding. And another finding is that actually both digital and non-digital interventions work. So that would be very important also in your present study. But as I said, it's only out there's a Danish report so far, but it will be out in English language articles. Then maybe it's a larger question that we don't have time to discuss now, but I'm very curious of your reflections on these three dimensions of loneliness that seem to often be taken for granted, that we have the social, we have the what is called existential, and also the emotional dimension. And you only, when you were pointing to, you only pointed to the social and the existential loneliness. And I think I have a problem with the emotional, because I think there's a strong emotional dimension to loneliness also in these two other categories. So if there is time, I would be interested in your reflections on that. I know it's a very commonly used model, but I struggle with it. Well, thank you very much, Anu. Thank you.
Yeah, thank you. We see if we can hear about that. But I just want to ask you, Christine, do you have any link to the Danish report? You maybe you could, if possible, if you could put it in the chat, could be great, or send it to us after.
Yeah, I will try to see if I can find it, but afterwards. After our discussion.
Afterwards, yeah, great. Move over to you, Karin. Lennartsson, what's your reflections on Anna's presentation, and how about your perspective and interventions, what you know about in Sweden?
Yeah, thank you very much for inviting me to this panel, and also thank you, Anu, for your presentation. As Anna said, I think it is very important that we are aware of these three dimensions of loneliness, and what are we expecting to achieve through the intervention. So we need to keep that in mind. I think that emotional and this feeling of loneliness might be very, very hard to intervene against, or how to say. But I also want to reflect on, we can't always, during this pandemic, we were restricted from physical contact. We shouldn't meet and socialize, and many activities were going from physical meetings to internet-based. And what I think we should remember when we are planning interventions through internet is that many people, we do not reach all. As I think it is a small fraction of the population that we actually can reach through internet. For instance, in Stockholm County, a couple of years ago, there was only 1 out of 10 women in the age group 85 plus that used internet, and 4 out of 10 men. And of course, the percentages are higher in younger age group, and it will change in the future. But also many people have difficult to access to technology due to health problems, physical limitations, and to skills. And we also need support. As we saw right now, there is always some hassles with technology. And if you do not have someone to come to you and help you, how can you then be involved in activities? So that is, I think it is very important. And we also know from research that many interventions lack information of design and methodology and how they conduct the intervention. So when we are going to try to do it again, we do not actually know what is it in what elements of the interventions are effective. we do not really know that. So, and we also know that people have how should I say, economical resources are also associated both with the access to technology, but also we know that people with lower economical resources more often feel lonely. So there is a problem there we should be aware of. I think I stop there.
Yeah, thank you, Karin. And I'm as a senior advisor in the area of welfare technology and digital transformation. I think the digital solution is the solution to everything. No, I'm just joking.
Yeah. But sometimes when we are discussing it, some people seem to think that. But when older people or when people are distressed, emotionally distressed, I don't think we can change physical contacts with digital contacts.
No. Well, I go over to you, Maria. What do you say about this, and also what your reflections on Anna's presentation and interventions in Norway out of your perspective?
Yeah, thank you. Well, first of all, Anno, I really enjoyed your presentation. I think Finland is doing great with finding new ways to alleviate loneliness, like you presented just now. So I think we can take an example of how Finland is trying to combat loneliness among older adults. So that was really, really great. What I also liked very much in your presentation is that you draw the attention to different types of loneliness. And previous people already mentioned this, and I have exactly the same. So the emotional and social loneliness, we are sort of familiar with that one. And then later, I think, came the existential loneliness. And as a loneliness researcher, I am trying to understand how that is different from the other two. I think there's a kind of overlap between the two. So I read an article written by Theo van Tilburg from the Netherlands, who tried to find evidence for these three types. And he says, yes, in the end, there are indeed three types. So we can, in a way, measure these three things, and they mean something totally different. And then I thought back to your presentation that, so if you think in terms of intervening, would you then say that it very much depends on the type of loneliness? And actually you mentioned it during your presentation, that you said it's very important to know what kind of loneliness the person is suffering from. I think I quote you correctly now. So and then I think, okay, if that is really important, who can we ask to sort of check with the older people what type of loneliness they have? So there, I'm not so sure. I think maybe we need to develop a specific questionnaire to check what type of loneliness they have. And if you agree, Anno, would you then say that we need to train the professionals to be sensitive for the type of loneliness people experience? Yeah, oh, you agree. Yeah, wonderful. So there, I think there's a way to go, maybe. And I totally agree. I think when it comes to emotional loneliness, I think Christine wanted to mention that as well. That is mainly seen in people who miss a partner, for example, who just lost this particular intimate other that we cannot replace with online context. I agree. So that would be my reflection. And then when it comes to Norwegian examples, well, we have very good examples, I think. The problem is that not many of these examples or interventions have been evaluated so far. So when there are some sort of reflections from the participants, like you have, Anno, also in yours, that people feel comfortable and they say, well, yes, it really helped, but with really measuring it and how long this effect will last, that we don't know exactly. My colleagues here at Oslo Met, they're evaluating sort of digital intervention. Also, it's this iPad thing, and then family members can send pictures to this iPad, and the receiver, the older person, can look at these pictures and is feels very much engaged in the family. So that is an example of an intervention that will be that is now currently evaluated, but the results will come by the end of the year as well. So great things happen this year in the end with finding evidence in a way. So yeah, so that was, I think, that was my main question. Do I still have time for my minutes, Bengt, or shall I stop here maybe?
You can stop there and then we go on. Thank you, Maria.
Yes.
But that, as you said, I think that is one thing we really lack of is the evidence when it comes to intervention. So wherever we are, we feels like that we lack of that. What do you say, Fredrika? And what's your reflections on Anna's presentation? And do you have any other successful interventions from Finland or from your perspective or?
Yes, first of all, I would like to thank Anu for a very interesting presentation. It's also so interesting to hear about an intervention that works. As you said, you have been going on for 20 years now and you have good evidence and your intervention seems feasible. I mean, it's quite feasible to do it in different settings. As you said, you can do it in institutions and in other settings. So I think it's a good example for all of us to hear about what you can do with rather simple, relatively little means to do it. What I was thinking about, I totally agree with the other panelists about this dimension of loneliness, but I was thinking when looking at the presentation about the context. Since my background is in social policy, we always think about context and that context matters. So I think also when we talk about interventions, we have to remember that loneliness is not only related to individual features. We also need to remember the context, and context is quite a vague concept. What do we mean by context? And it means that loneliness is very much dependent on where you live. If you live in an urban or rural area, or if you live in a disadvantaged or advantaged area, or it even matters, as I have seen in my research, in which country you live in. And we argue that how you organize the whole welfare system, the welfare services for all the people is important. If you have more comprehensive welfare system, more welfare services to all the people, the loneliness levels are also lower. And I was involved in an interview study we did a few years ago where we interviewed older people receiving home-based care. And it was really, one important result was the meaning of the home care staff as a resource for including also older people living at home. And we know that resources have been cut down in elderly care in Finland and in all Nordic countries. And usually when you cut down services, you cut down the social services. So, I mean, this is also, when thinking about how to reduce loneliness, we also need to remember how we organize our societies and what type of welfare system we have. When it comes to your second or other interventions in Finland during this COVID time, I couldn't find any other except yours, Anus, when I looked quickly on the internet. I'm sure there are also studies in Finland going on, but maybe not yet published. I was myself, if we broaden the concept also to well-being, I was involved in a study where we looked at promoting well-being among informal caregivers. So maybe, and we saw that, and we had to change our activities also to online instead of doing them face-to-face. And there were, of course, advantages and disadvantages with that type of intervention, but maybe I could put it in the chat, the link to the publication, if anyone is interested in reading about well-being in informal caregivers.
Yeah, great.
Thank you.
Yeah, you do that. It would be great if you put that. Thank you. Thanks a lot, Fredrika. Christopher, you hear what we're struggling here up in the north when it comes to interventions and the lack of evidence, despite of what Anno presented and what they are doing there. But from your perspective and your reflections on Anno's presentation and from what you hear from the other panelists, what's your reflections?
Yeah, very similar, very similar in many ways. But first, I'd like to thank you, Anu, for your very interesting presentation. I was really happy to hear that there are plans to evaluate the Resetas intervention with an RCT, because I think a big problem in the field, as people have already alluded to, is a lack of kind of methodologically rigorous evaluations. And I'll come back to that in a minute. Personally, I was very interested in the nature-based social prescribing intervention and the involvement in nature. And there's a body of evidence in violence prevention that shows that people who live near parks, near greenery, are less violent. And these are actually randomized control trials, some of them, are really, really high quality studies, are less violent than people who live in purely urban settings. So obviously nature has an important role. I don't think we all exactly understand what it is, but I was very interested to see that. I'll say a little bit about, the general problem of evidence. We've been going over the evidence. We did an advocacy brief. I reviewed all the evidence. I had a long chat with Mathias Lasgaard, who was one of the authors, maybe the main author of that Danish meta-analysis that Christine alluded to. And we also held a meeting about developing an evidence portal for interventions for social isolation and loneliness, where we kind of synthesize and distill. And what I'm hearing and reading from all these different sources is that lots of different interventions have been tried over the years. There's no shortage of interventions, but too few of them have been evaluated in high quality studies for us to have strong conclusions and to make strong recommendations. And really that, I think, should be the priority, is these high quality evaluations, so we can actually recommend things to people. Because at the moment, that's what, these different people I've spoke to all agree. We're not in a position to say, do this and don't do that. It's this one may work, pretty good evidence, but we're not really sure. That one probably not, etc. So I think that really is a priority. And what we're doing is we're doing 2 evidence and gap maps. We're mapping all the evidence of digital interventions, and that's partly in response to COVID and the increase in the use of digital interventions. So digital interventions to reduce social isolation and loneliness, and face-to-face interventions. And that's really to try to identify where there is better evidence, where there's weak evidence, and then to commission evidence in a more kind of coordinated and strategic way, and to make sure that evidence is of the highest quality possible. You find this problem in many different areas. Lots of studies have been done, but unfortunately, they're all not so good. You can't draw any strong conclusions. And in a way, it's a monumental waste of time and energy, because people have done these studies, money has been spent on them, and then you can't do that much with them. So I think there really should be a call in this field for higher methodological standards. And it's not the only field, it's a widespread problem. So those are some of my reflections. But yeah, no, I was really pleased to see that what you're doing in Finland. And I'd be very intrigued to find out about the results of your RCT of Resetas.
Thank you. And now we'll look into if we have had any questions from the chat. Yes, and we have a question for you, Anu. Was Finland's health policy recommendation of going to nature informed by strong evidence? Any major study find out the correlation between visiting nature and reduced loneliness among older adults? Our recent published study reported that evidence was not very strong, so I wonder what findings the Finland's recommendations is based on. Well, you were a little bit into that, Christopher, but that's a question to you, Anu. It was several questions in one, but yeah.
Yes, there were very, very important questions and difficult one, I must say. I think Tia Gnadu would answer better for these, but well, I don't know if there has been much maybe randomized control trials or behind these suggestions. I'm not sure. And Tia is working in this this organization which took these restrictions. So maybe I suggest that Tia is answering maybe this question.
Yeah, maybe Tia could go into the chat and see if she could do. Or you're there, Tia. Yeah.
Yeah, I can just quickly mention that I'm sorry, I don't know either. I work at the same institution, but was not behind these recommendations.
Okay. Yeah.
Tell much more.
It is very difficult question. Yeah.
Yeah. And then we have to all panelists more general question. Are there any studies regarding loneliness and everyday activities in the neighborhood city districts like go shopping, hairdresser, pharmacy, library, etc.? There's a question if you know of that. If you heard about that? No?
We went over some of the evidence for more environmental interventions like the built environment and transport, and everybody agrees that they're important. But here again, and there are some good studies showing that some of these environmental factors, if they are modified, it reduces loneliness. But again, there isn't a huge amount of evidence. I know there's some pretty good studies on transportation, like making transportation free for pensioners in the UK. Showed that it reduced loneliness a little bit and depression a little bit. So pensioners could kind of travel more easily, more cheaply.
Yeah. I think there, as we said, and I think all of you brought up that there is a lot of what I say best practice going on when it comes to interventions. But how can we work to get more evidence and research in this area to get these high quality evaluations, as you mentioned, Christopher? How should we do this? What do you think?
I have an idea, but I think in this field, like in many other fields, there's kind of a need for what I call an intervention accelerator. It's really linking people who are developing interventions, who are evaluating interventions, or scaling up interventions, so that they share their knowledge and encourage them all to evaluate using better methods, and to join forces and to share their knowledge. And this can be within a country, within Scandinavia, Europe, the world, whatever. But I think developing networks of people working on this to avoid duplication, to benefit from economies of scale, to share knowledge, etc., would really be a priority. Because I said before, it's kind of a great pity for lots of people to do small studies which add up to a lot of money and time from which we can't really draw good conclusions.
Great. So what we do here at the Nordic Welfare Centre with networking and together with this Nordic is, could be a part of it. Christine, you raised your hand.
Yeah. Yes, I just want to say that together with Mathias Lassgaard, that you, Christopher, just mentioned, who is our main analysis of the figures we have in Denmark on loneliness, and also is a prime researcher on this report I just mentioned. We together with him and other organizations are making what is called a collective impact project in a particular municipality in Denmark that has now baseline knowledge about the young and the old on loneliness, and that is also looking into how interventions will work over a period of 4 years, following different realms in this work to alleviate loneliness. So I think in a not too distant future we will have some knowledge, of course not covering the whole range of many different situations. And I also really acknowledge, Frederica, I'd like to say the context, even though it's hard to coin what the context variables are, that they are very important. But we should come up with some knowledge that could be useful also in this area. Thank you.
And I'm very curious about one question to you also that I put in the other panelists. How could we sort of learn from this pandemic period when it comes to interventions and what to do when the next pandemic or crisis will come? Have you been thinking of that? Or what's your reflection on that, Fredrika?
I think Thomas, I borrow his picture. He was asking in the beginning, do we sit in the same boat? And I think we do not sit in the same boat. No. So all these inequalities in loneliness that was before the pandemic was even exacerbated during the pandemic. So I think it is important to focus on inequality issues to be able to tackle future challenges.
Maria.
Yes, I agree. And I think another perspective that is important that we didn't mention so far so much is to have so to prepare older adults for the next pandemic, rather than preparing research, but preparing older adults for the next pandemic. Partly is, I think, indeed to increase their digital skills, because most likely it will be socially distancing again. But another thing is maybe that we all should try to build strong social networks before anything happens. And the strong network, I think, is a heterogeneous network with different type of people in it. So we should maybe try to learn how to create stable social networks that are supportive. That is one thing. And the other was that I think a life course perspective should be there as well. So transitions in the past or ill transitions in the past, I think have a reflection on how we respond to pandemics in general, not only older people, but we also.
Okay, time flies. It's soon 12 o'clock and here in Sweden, and we're not much left of this session, this webinar. So Anu, Fredrika, Kristine, Maria, Karin, and Christopher, a big thank you for participating and contributing to this webinar. And I will just finalize this webinar with summing up a little bit. And before we close today, we just want to mention that we at the Nordic Welfare Centre have been given a new assignment that is led by my colleague Kaisa Kepsu. The new project is called Loneliness and Social Isolation During the COVID-19 Pandemic, and has the aim to contribute to Nordic knowledge about how we can prevent negative feelings of isolations. At the forefront of this work, we'll be learning lessons from Corona pandemic so that Nordic societies can be better prepared for future crises. In the project, we survey the consequences of isolations and loneliness during the pandemic and identify particularly vulnerable groups. Then this project will be conducted during 2021 and 2022. And Kaisa and we from the Nordic Welfare Centre will for sure get back to you with more about this during 2022. So more will come. And I thank you all panelists and presenters and also participants of this webinar. Thank you all and see you again. Bye.